Let's go to work. Hopefully I put the keys in my pocket. I feel like I maybe overestimated the temperature. So with every shift, I sit down and I begin with either reviewing the patients that are waiting to be seen or looking over results from previous urgent care visits to see if any require a more urgent callback than others. On this particular shift, I had 2 patients that were already roomed and waiting to be seen. So I briefly just looked over their charts, reading, of course, their chief complaint, their vital signs, medical history, any medications that they're on, any allergies that they might have. Of course, regardless of what's listed in the chart, I always make sure to confirm that the information is accurate when I go in and assess the patient. All right, so let's go see our first patient. Patient is a 3-year-old female brought in by her father for a right wrist injury 1 hour prior to arrival. Father states that the patient was playing and jumped off of the couch, landing with her arms outstretched. Father states that since the incident, patient has been tearful, holding the right wrist and not using it. Reports mild swelling to the right wrist, denies deformity or ecchymosis. Patient did not hit her head, denies loss of consciousness, vomiting, and behaving normally per parent. Has not taken any medications or done any treatments at home. Okay, so that was the HPI for the patient. So on exam, what did I see? Patient was calm, however, they were guarding their affected wrist. There was mild swelling, no obvious deformity or ecchymosis. Sensation was intact, neurovascular status was intact. I did not attempt any range of motion to prevent any further injury. I did address the pain and had given the patient ibuprofen. And of course, what I did ultimately was order a series of wrist x-rays to determine if she did indeed fracture her wrist. Also, good point to remember that with children, it's important to get bilateral imaging to make sure that you get a good comparison view to help with the growth plates and determining if there is a possible Salter-Harris fracture present. So let's look at x-rays. So if you look on the right wrist, there is widening of the distal radius. You can see it in all views if you look really closely, and that's a strong indicator for a compression fracture of that distal radius. And so here you can just get a much more zoomed in view where you can see that sort of widening or irregularity of the radius there. So for the treatment plan for this patient, of course, we educated on RICE, so rest, ice, compress, and elevate. We did place her in a volar splint and also referred her to an orthopedic. Also, we educated on using anti-inflammatories such as Motrin for pain relief. All right, so for our next patient, the HPI reads, patient is a 54-year-old male with a pertinent medical history of diabetes and recurrent abscesses, here with a cutaneous abscess to the right shin. Patient states that he had an unknown bug bite him 1 week ago, and he noticed that the swelling, redness, and warmth increased yesterday. Denies fevers, body aches, nausea, vomiting, diarrhea, neuropathy, and he feels otherwise well. He has not taken any medications at home or tried any treatments at home. So on exam, the skin is warm to the touch. It's erythematous. There is an approximate 3 by 4 centimeter fluctuant abscess present, and there's a scab in the center of the abscess, which patient states is old and it occurred from itching where the bite initially occurred. Sensation and neurovascular status remain intact. So because the abscess was fluctuant, an I&D or an incision and drainage was performed. Of course, I first did a field block using 1% lidocaine to numb the local area. A moderate amount of purulent fluid was successfully drained, and I also did treat the patient with antibiotics as well. I treated him with 7 days of Bactrim, which is a good option because it not only treats against Streptococcus, which is the predominant cause for cellulitis, and abscesses, but it's also effective against treating MRSA. So because the patient was treated with antibiotics and they have a history of recurrent abscesses, I also collected a wound culture. So in practice, wound cultures aren't always required except in the following situations. And so I made this little picture here to help. So wound cultures are not indicated if the patient is immunocompetent and is not receiving antibiotics after the IND is performed. However, wound cultures are indicated if the patient is being treated with antibiotics and meet at least one of the following criteria listed here on this slide. Alright, so here I am back at my computer charting. As I mentioned in my previous video, my general flow is that I see 2 patients and then I come back to my computer to chart. So this routine has really helped me to maintain not only a good flow with the patients, but it's also helped me to stay on top of my charting so I don't have a lot, or if any, at the end of my shift. All that's required of me, of course, in regards to charting prior to the patient's discharge is their diagnoses, any interpretations, that's including x-rays, EKGs, treatment plan, and that includes any prescriptions, patient education, and follow-up plan, including any referrals if those are indicated. Everything else can be done after the patient is discharged home. Alright, so the next patient's HPI reads, patient is a 51-year-old female with history of hypothyroidism, here for tailbone pain after suffering a fall onto her tailbone 3 days prior to arrival. Patient states that she tripped over her dog's leash and fell directly onto her tailbone. She reports bruising and tenderness to palpation at the sacral area, denies hitting her head, loss of consciousness, daily blood thinners, and any other injuries. Also denies saddle paresthesias, numbness and tingling, urinary or bowel incontinence or retention. She has been icing and using extra strength Tylenol at home without any relief. So on exam, patient was standing up because the pain was so severe when she was sitting down. She was tender to palpation at the coccyx, and there was some mild ecchymosis or bruising seen. No swelling, no obvious deformities or step-offs, and her skin and sensation were intact. So x-rays were done, and the patient did indeed fracture their coccyx. These injuries are very conservatively managed, and emphasis is really placed on symptom or pain relief while the bone heals. So one thing I always do for these patients is I write them a script for a donut cushion to help displace that weight off of the tailbone while sitting. Also, I gave this patient a short course of NSAIDs, Toradol shot in the office for pain relief as well, and instructed them to follow up with their primary care. Alright, so for the final case study of the day, of course I saw more than 4 patients during my total shift, but I'm only sharing a few case studies for this video, and I choose examples that I obviously feel are really great representations of what you will see working in a busy urgent care similar to the one I am currently working at. So HPI reads, patient is a 19-year-old male without any pertinent medical history, here today for a fever, sore throat, body aches, and fatigue times 2 days. Patient states that the throat pain is severe, causing him pain with swallowing and talking. He denies nasal congestion, cough, chest pain, shortness of breath, nausea, vomiting, diarrhea, and loss of taste or smell. He denies any recent known sick contacts. However, he does currently live in a college dorm, has not tried any treatments or medications at home, and is COVID vaccinated. On exam, the patient's voice is muffled due to the throat pain, and the patient is just visibly very uncomfortable. His tonsils are both erythematous and hypertrophied, and there is purulent exudate bilaterally. Also, the cervical lymph nodes are palpable and tender. With this patient, because there was so much tonsillar exudates present and tender cervical lymph nodes, with the absence of a cough, I initially ordered a rapid strep test. This is directly from the Centaur criteria, and if you're not familiar, then the Centaur criteria, it's super easy to use. So you get a point for each symptom that's present, and that includes tonsillar exudates, tender anterior cervical lymphadenopathy, fever, and the absence of a cough. So patients who score a 3 or more should get testing done. So if a patient presents with this infectious appearing of a throat, then the series of which I do tests is as follows. First, I do a rapid strep test in the office. Those are nice and quick. They take only about 10 minutes to result. However, they're not as accurate as a throat culture. If the rapid strep test is negative, then I do a monospot in the office, which is a quick finger prick, only takes again about 10 minutes to result. If both the rapid strep and the mono are negative, and I plan on treating with antibiotics based on my exam, then I do a throat culture prior to initiating antibiotic treatment. And this is the general procedure in my office. However, for full transparency, literature does state that it is appropriate and likely preferred to not treat a patient with antibiotics empirically and to actually wait for the culture to result, as a short delay in antibiotic therapy has not been shown to be associated with a higher likelihood of complications. Regardless, in this case, the patient tested positive for mono and was given a Toradol shot in the office to reduce the swelling and improve the patient's pain. The patient was also educated on the course of the illness and how to avoid a potential splenic rupture. That's including avoiding any strenuous contact sports or activities that could cause chest or abdominal trauma for the 4 weeks following their diagnosis. Because Epstein-Barr virus can be shed intermittently for months and up to years, it's therefore difficult to trace a source of infection, and so there are no hard restrictions for patients returning to work or to school. Instead, a decision should be made between the patient and the provider based on the patient's symptoms when it's going to work best for them to return to their normal daily activities.
All right, so a little add-on to this video. As some of you might have seen on my YouTube channel, I shared like a community post saying that I had reached 5,000 subscribers, how happy I am, how cool I think it is to how much this channel has grown and how many people I've got to like really connect with in this group, and like the YouTube channel and the Facebook group, all of the platforms. I've just met and interact with so many cool people. I have a lot of goals for this channel. I really want it to continue to grow. It's turned into such a hobby of mine. It's like a creative outlet for me, and I've learned how much I love teaching. But that's not the point of this. The point of this is that because I reached the 5,000, because I reached this number, I'm just really excited to see it continue to grow. I wanted to do a giveaway, and so let me show you. I'm just gonna set you down for like a second. So I thought this would be a great giveaway gift for somebody that wants to work on their suturing skills. So it's a suture practice kit. It comes with so much stuff, you guys. So it comes with, let me show you, hold on. Okay, so you can kind of see everything it comes with. It comes with a silicone pad, 14 different cuts or, replicas of wounds there that you would suture, lots of different suturing material. You have your scissors and your forceps and all the things that you would need to practice in learning your sutures. So to enter for my giveaway, all you need to do is be subscribed to my YouTube channel, and also
I don't know why the audio cut out on this part, but the second part that you need to do is like and comment on this video. So make sure you subscribe to the channel, like and comment on this video, do all the parts so that I can select a lucky winner.
And I will pick a winner over the next couple of days, and I will ship this to you. That's all you need to do. I can't wait to give it to somebody. I love giving gifts to people, so I'm actually super excited about this, and I want to do more giveaways. This just makes me so happy. So make sure you do all the things so you can be entered into the giveaway, and I can give this to somebody who will use it and learn and practice their skills before going into practice. You guys are the best. I love this community. It's been such an uplifting experience for me. So don't forget to do all the things. Like the video, subscribe to the channel, comment here, enter the giveaway, and I will talk to you guys very soon.